So what are the leading health indicators? For 4 decades, Healthy People has provided a comprehensive set of 10-year objectives that have served as a framework for public health activities at all levels and across the public health community. Healthy People is about understanding where we are now and taking informed actions to get to where we want to go over a 10-year period. Addressing these public health challenges, such as tobacco use, access to health services, and overweight and obesity, will help us reduce some of the leading causes of preventable deaths and major illnesses. These indicators are organized under 12 topics, allowing us to focus in on a specific topic each month over the past year. This month, we're focusing on the critical issue of environmental quality. During today's webinar, you'll hear from distinguished speakers. Dr. Don Wright is the Assistant Secretary for Disease Prevention and Health Promotion at HHS. He will give you an overview of this month's LHI topic, environmental quality, and present the latest data for environmental quality LHIs. Mr. Bill Wiley will discuss Maricopa County's success in improving reducing exposure to unhealthy air by implementing a monitoring and response system and providing the community with timely notifications of potential health risks. Then also during today's webinar and during the roundtable discussion, we'll be joined by Dr. Stephen Kleberger and Mr. David Mintz. Dr. Kleberger is the Director of Environmental Genetics Group within the National Institutes of Health and an expert on the health effects of air pollution. Mr. Mintz is a statistician at the Office of Air Quality Planning and Standards within the Environmental Protection Agency and an expert on the Air Quality Index. We're excited to have these distinguished speakers here today, as well as our guests who will be joining us later. I'd like to remind you that during the course of this webinar, you may submit your questions to our speakers and panelists using the chat feature to the right of your screen. We'll address these questions during our roundtable discussion. So with that, I'd like to introduce Dr. Don Wright. So Don, the show is yours.
Thank you, Carter. Before we hear from Mr. Wiley, I'd like to give you a brief overview of this month's leading health indicator topic, environmental quality, or exposure to unhealthy outdoor air. An environment free of hazards, such as secondhand smoke and various forms of air pollution, helps prevent disease and other health problems. Implementing and enforcing environmental standards and regulations, monitoring pollution levels and human exposures, building environments that support healthy lifestyles, and considering the risk of pollution in decision-making can improve health and quality of life for all Americans. The Healthy People 2020 leading health indicators for environmental quality are Air Quality Index, or AQI, exceeding 100, and children aged 3 to 11 exposed to secondhand smoke. Maintaining a healthy environment is central to increasing quality of life and years of healthy life. Poor outdoor air quality can be attributed to both natural sources of pollution, such as dust from windstorms, as well as human-generated sources, such as emissions from vehicles. The health effects of poor air quality include respiratory diseases such as asthma, cardiovascular diseases, and changes in lung function, and even death. While many factors contribute to poor indoor air quality, secondhand smoke is one of the most pervasive of these pollutants. During 2007 through 2008, approximately 88 million non-smokers were exposed to secondhand smoke in the United States. In adults who have never smoked, secondhand smoke can cause heart disease and/or lung cancer. Breathing secondhand smoke can be harmful to children's health as well, and has been associated with asthma, sudden infant death syndrome, bronchitis, and pneumonia and ear infections. So what are the health effects? Exposure to outdoor and indoor pollution can cause both short-term and long-term health effects, including damage to the immune, neurologic, reproductive, cardiovascular, and respiratory systems. Decreasing air pollution and eliminating exposure to secondhand smoke are important steps in creating a healthy environment and improving the health of all Americans. The number of people with asthma continues to grow. 1 in 12 people, about 25 million or 8% of the population, had asthma in 2009, compared to 1 in 14, about 20 million or 7% in 2001. Asthma cost the United States about $3,300 per person with asthma each year from 2002 to 2007. More than half, 59% of children, and one-third, 33% of adults who have had asthma attacks missed school or work because of their asthma in 2008. On average, in 2008, children missed 4 days of school and adults missed 5 days of work due to their asthma. In 2009, there were almost 500,000 asthma-related hospitalizations, 2 million asthma-related emergency department visits, and 9 million asthma-related doctor visits. Asthma is triggered and exacerbated by environmental factors such as outdoor air pollution and secondhand smoke. By addressing the 2 environmental quality LHIs, secondhand smoke and outdoor air quality, we can help individuals reduce or eliminate exposures to these triggers. Safe air, land, and water are fundamental to healthy community environments. In the next few slides, I'll provide you the latest data on environmental quality leading health indicator. Healthy People 2020 objective, tobacco use 11.1, tracks the proportion of children aged 3 to 11 who are exposed to secondhand smoke. Although many groups, including the total population, have met this target, note that the target is based on a 4-year estimate, and the most recent 2009-2010 2-year estimate will be replaced with a more stable number in the upcoming years. Among racial and ethnic groups, Hispanic children ages 3 to 11 had the lowest rate at 30.7% of exposure to secondhand smoke. The rate for non-Hispanic black children was 67.8, more than twice the rate of Hispanics, and the rate for non-Hispanic white children, 41.7, was nearly 1.5 times that of for Hispanics. Children born outside the United States were less likely to be exposed to secondhand smoke than children born in the United States, 18.7% versus 43.2%. The rate of children born in the United States was nearly 2.5 times the rate for children born outside the United States. Lastly, among insurance groups, children aged 3 to 11 with private health insurance had the lowest rate of secondhand smoke exposure at 31%. Children with public health insurance, 55.8%, had nearly 2 times that rate. And children with no health insurance, 46.5, had about 1.5 times the rate of secondhand smoke exposure. The number of air quality index-weighted people days declined 44% from 2.2 billion to 1.2 billion between 2006 and 8 to 2009 through 11, meeting the Healthy People 2020 target of 1.98 billion. However, this trend cannot be tested for statistical significance. While the data indicates that the target has been met, monitoring over the next decade is crucial to ensure progress continues. Although the AQI is highly dependent on local, seasonal, and annual variation in weather, air quality has been improving substantially for several decades.